What are the contraindications for not having a copper T is like other problems where we don't usually advise a copper T is like you should be definitely sure you're not pregnant. So I usually advise copper T in the first 5 days of the periods. The second thing is in case you have an active infection, pelvic infection, I don't insert a copper T. And you have some unexplained vaginal bleeding, or there is it looks like a suspicious growth on the mouth of the uterus. I usually don't insert a copper T. Otherwise, by and far, even for heart disease patients, for patients who are on some long-term epileptics, or people who are on seizure medicines, we cannot advise oral contraceptive pills because the hormones and those pills will interact. But whereas a copper T is very, very beneficial for all these people. Although it is yes possible, why it is possible? I mean, it is definitely possible. There's no problem in inserting a copper T. But see, copper T, there is always a chance of you catching a pelvic infection. Yeah. So when you don't have a child and you have a foreign body inside you, and if you have got a pelvic infection, long term your fertility might be affected. So my personal opinion and my experience is that I wouldn't advise a copper T to a lady who hasn't had a child yet. On the other hand, I would advise it to a lady who is breastfeeding or who is not able to take pills for some other reason. That way, that time it is very good. Most of the women who come to me for a copper T insertion, whenever I say copper T to a lady who has delivered, who is breastfeeding, who has not much options other than condoms, so they usually don't prefer copper T because there are a lot of myths surrounding it. Yeah. So the first thing is they say it's very painful and it might go and rupture the uterus and it can go inside the body and other things. It's like, it's as funny as telling that if you go for an outing, you might be hit by a car or something like that. Okay. Just because it's a rare complication doesn't mean it needs to occur to you. So that you have to remember. So it's usually a very small procedure. We do it in the OPD basis. So I usually call the patients on the 5th day of the periods when your mouth of the cervix, mouth of the uterus is a little open, but still you're not bleeding. So it's very ideal time to insert the copper T. And it takes only 5 minutes for me to put in the copper T. Once you are done, we would make you check the threads, and you can be out of the OPD as soon as it is inserted. Post copper T insertion, I make them feel the thread in the after I have inserted itself, and you should be able to feel the thread. And every month, once at least, you should be able to feel the thread. If you don't feel the thread, go back to your gynecologist and ask them, tell them your problem. They will scan you and see whether the copper T is still there inside or not. Sometimes the thread will be just coiled inside. You might not be able to feel through the vagina, but otherwise the copper T will be still inside. So that time your doctor will be doing a scan and just will be reassuring you. Sometimes what happens is after delivery, the uterus will be a little long and there will be a lot of contractions of the uterus. So after delivery, the copper T that are inserted, what happens is it would have fallen down. So many women do not even notice because they never check the threads. So that is a very important thing that you have to do.